Next, we have Dr. Prithvi Chandrakanth, who would be talking to us about the magic of 3D printing in ophthalmology. So 3D printing is one of the technologies of the fourth industrial revolution, which is very, very useful for an innovator. And if you learn 3D designing, 3D printing, you can make anything that you can imagine in your mind. So over to you, Dr. Prithvi Chandrakanth.
Thank you, Dr. John, and thank you all India for giving me this opportunity. I'll be talking about 3D printing in ophthalmology. There is financial interest Dr. John has in few of these 3D printed materials. So what is 3D printing? It is printing a physical object using a printer. That is what it is basically. So it consists of designing. You use a CAD software and design one product, and then you transfer it to the printer. So it will slice it and then start printing it. So before that, a post-processing is done, and then you get a final product. So this is what is a whole process of 3D printing. So this product is actually a proper, so it can be done with using a polylactic acid or a ABS material. Polylactic acid is much more easier because you can prototype and it is a little brittle. But then if you want a more better version, you can use the ABS ceramic or even titanium and stainless steel material. So what are the methods? One is extrusion, by which the filament comes out of the 3D printer and it makes up the product. But then there is something called a sintering, where a laser comes in and melts the steel or metal and makes a product out of it. So these are all the materials which can be used for making a product. SLA is one of the most easiest thing, and for bioprinting we use inkjet. So where do we actually able to design? So there is something called an online designing platform, that is Tinkercad. So over here what you can do is you can just go in online, log into your account, and then you can start designing your own 3D printing device. It is basically, using cylinders, cube and all those things, put it together and design your own 3D model. The only thing is you need to be very sure about the measurements. And this is something which all children even are doing now. So it is so easy that even children are doing. So you can do it by yourself if you can go into the Tinkercad, and it's a basic thing. If you want a more modified, advanced thing, you can even buy the software. And then if you want free 3D printable objects, you can go to Thingiverse. So in this website, you can actually browse for things which you can download for free of cost, and you can send it to a vendor who can 3D print for you. So all the cities actually have at least one 3D printer, or even if you don't have, you can get it, parceled it from any other city also. It's so easy. So 3D printing in ophthalmology is being done in various specialties, and there is a few articles written by Dr. John on this subject, which you can go through. So the first thing which we would see is 3D printing adapters for surgical instruments. So surgical recording. So this can be used for recording videos in our OT. And then one of the most red cams are the most ones made in 3D printed. The first ones and the most 3D printed material were the red cams. Over here you can see the ODOC fundus camera. So these are all the other different Indian 3D printable cameras which are available. This is a foldable 3D printed John Dash foldable fundus camera, which Dr. John has patented now actually. So it will be in the market soon. So here you can see the demonstration of how it is foldable, and it is very easy to keep it in your pocket itself. So you can just take it around in your pocket, you can just open it and start taking fundus images on the spot. This is a 3D printed slit lamp. So you can have a slit along with a magnifying lens, which will help you convert your phone into a slit lamp. There is even a peak retina, which is 3D printed for taking images of the disc. There are 3D printable models which can be used for surgical wet labs, like Cordelia, and these are all. This is one of the 3D printable model done by Dr. Prashant, and this is used for phacoemulsification. And there are 3D printed materials for orbit dissection where you can actually practice your orbit surgeries. It can be used for your fellow training. And there are 3D printable models about for radio surgery where you can actually print the case, and then you can see what is the least radioactive place where you can give the treatment. There are 3D printable OCTs where the retina has been, OCT retina has been converted into 3D models for use of, to counsel the patients more easily. There are 3D printable designing for instruments, even trocar cannula which can be designed. We have done something exactly. The first thing was to there are even reconstructive surgeries where you can use these material for orbit blowout fractures. There are implants which have been 3D printed nowadays, and it all can be modified according to the case. So if you have a case, you can just see how much measurement you want, and you can actually 3D print exactly the measurement which you want. There are 3D printed prosthetic eyes which are available now, initially started in South Korea. And recently we have seen a growth in spectacle. So the spectacle market has started 3D printing spectacles even. And one more thing is, it is very easy if you have any kind of facial problems, you can actually measure and 3D print a spectacle exactly to the measurement of the face. You can see a article written in the same thing. So there are a lot of other things which we can do, but because of want of time, we'll go through the 3D printed things which we have done in our setups. There are even 3D printed cornea and retina which we have just started. This is a 3D printed eyedropper helper which we have done in Arvind Eye Hospital. And this is also a dry lab 3D printed eyeball where you can use it for indirect ophthalmoscopy. You can use it for indentation. You can see how the material can be used for indentation over here. Also, it can be used for teaching lasers to the trainees. You can see over here how we can train new residents and optical technicians. Over here we have a 3D printed simulator for the patients where you can show them the light and explain to them how it will look during surgery so that they will cooperate more. And there is a eyedropper which is incorporated to the glass frame. So this is a glass dropper, and we have an eye opener which can be helped, which we can use to cotton buds, and actually it will help you open the eye during foreign body removal, etc. There is a 3D printed 90 holder. During the COVID, it was very important for us not to have, cross infections. Over here, there are a few 3D models, a surgical instrument which Dr. John has made, which is available in Thingiverse for free. So you can actually download these 3D printable models and use it for your training as well. Going to a few of the things which I have made. There's something called a slit scope which we made. The 3D adapter is actually used to convert the torchlight into a slit light. So with this, what you can do is you can start taking images of the eye without a slit lamp. So you don't really require a slit lamp. You just put the adapter to the torch and then take images. Then we have the gimbal scope where a small attachment, the 3D printed attachment, is put to the retinoscopy device, and then the camera which comes out of it will start recording the reflexes, which makes it very easy for you to actually teach your residents on how the reflexes look with against the null point, the scissor reflex. You can see a small demo of the reflexes. And this was one of the first device which actually is able to record the retinoscopy reflexes, which was not done before. You can see against the movement over here. Then we go to the retilite, especially for the retina surgeons who are more dependent on the illumination. What if something happens like the illumination goes off during surgery and then you don't have anything else to, carry the surgery forward. So we came with a small innovation where we make the device using 3D printed PLA. At one end, the optic fiber head goes, and the other end is connected to the LED. So this is a mix and match of different adapters we can do over here. So over here you can see the LED is in one part, and this part is for the illumination head. So once you put this over here, so this fits snugly over there, and then you can even on the LED over here, and once you connect it, you can actually see the illumination in the other part. Going to one more problem which vitreoretinal surgeons face is they don't know where the port is because the room is dark. It is very difficult for them to actually find the port to put the instrument inside. So we devised something called the glow port. This is a 2 millimeter ring kind of a structure which is made up of glowing material. So what happens is with this, you can see how beautifully those glow ports glow in the dark, and it makes it very simple for the retinal surgeon to actually put the instrument into the eye without onning or offing the light. So you can all start printing your own thing and designing your own in Thinkercad. Thank you.
Thank you, Dr. Prithvi, for that amazing introduction to 3D printing, the magic of 3D printing. So all of you here, be inspired, start learning how to do 3D designing. It's very simple. Learn it online from the University of YouTube. And once you do that, you can start turning your dreams into reality. Practically,